Dr. Melba D'Souza from Thompson Rivers University, an associate professor. Is that correct?
Assistant Professor, Andrea.
Assistant Professor, Thompson Rivers University. We have McCarthy, who's from a nonprofit society looking at supportive care in Kamloops. Biruta okay. Groves from the breast cancer support group. Cheryl Dedels, also from the breast cancer support group, and Grace Labossiere, who's as well from the breast cancer support group, and all of them also are part of the Spirit Warriors, who are a dragon boat team in Kamloops. So I would also like to acknowledge that Michelle Smith, the practice lead for research and knowledge translation from Interior Health, is presenting with the team today. And they will be speaking about symptoms of distress and emergency visits among women diagnosed and treated with breast cancer in the interior region. And this is a community participatory action research. So I will hand it over to you, Melba.
Thank you, Andrea. Thank you, Holly. At the start, we like to thank the Interior Health Research Department and the BC Support Unit Interior Center for giving us an opportunity today to present some of the work that we have been doing together with the several partnerships and collaborators, and some of them whom you have introduced today. Before we begin, I'd just like to acknowledge the ground that we are on and acknowledge the Symptom Nation on whose traditional unceded land Thompson River University is located. I'm grateful for the Symptom Nation's generosity and hospitality while we live, learn, and work. I also acknowledge and stand in solidarity for some of our colleagues, peers, and friends who have family back in Ukraine. So I want to open this talk also to my team members to introduce themselves at this time. So you can go ahead and Biruta, Cheryl, to introduce yourself, Michelle, and Grace.
I'll go first. Thank you, Melba. My name is McCarthy. I'm with the Kamloops Cancer Supportive Care Society. I previously worked in research at Thompson Rivers University and have a long-standing research partnership relationship with Dr. D'Souza and Dr. Ehsan Latif. I'm also currently receiving treatment as a metastatic breast cancer patient. So I have a unique view on cancer supportive care, as you can imagine. Thanks. Grace. You're muted, Grace.
Hi, I'm Grace Labossiere. I'm a 20-year breast cancer survivor, member of the Spirit Warriors Dragon Boat team, and currently facilitator for the Kamloops Breast Cancer Support Group, which we started in 2017, I believe. Cheryl.
Hi, my name's Cheryl Dedels. I was diagnosed with stage 3 breast cancer in 2015. I used to work as a secondary school teacher, but I'm currently retired. I'm serving right now as the president of the Spirit Warriors, and I'm also a co-facilitator with the Cancer Support Group.
Hello, my name is Biruta Groves. I'm a 10-year breast cancer survivor. I also belong to the Spirit Warriors Breast Cancer Survivor Dragon Boat team here in Kamloops. I facilitate the Kamloops Breast Cancer Support Group, and a few of us also belong to KCC, which is Kamloops Cancer Connections. And I'm very happy to be presenting today. Thank you.
Hello, I'm Michelle Smith, and that is an amazing group of people that Melba is working with. You're an amazing group. I work with in the research department as a practice lead with research quality and knowledge translation with colleagues here today, Holly and Andrea, and many others that try to support work in community and healthcare across interior health and beyond. So I'm really happy to be here and support this project.
Thank you, Michelle and team. Dr. Ehsan Latif is an economist at the Thompson River University. He's working on the cost-effective framework He may or may not be joining us today. This research that we have been doing is built on a theoretical framework and the research methodology as we have progressed in the study. Today, we just want to talk a little bit about the barriers and experiences in cancer care oriented towards cultural and ethnic diversity, and looking at strategies and recommendations in the cancer-oriented journey for women who have been with different aspects along the journey towards their cultural and ethnic, and looking and understanding these interventions that we could help and plan for the community and for the interior region. And at the end, we want to give some time for questions and discussions. So I hand it over to Anne.
Hi again, everyone. I'd just like to speak very briefly to the origins of the Kamloops Cancer Supportive Care Society. This arose out of my own search for cancer supportive care after my metastatic diagnosis, and in finding other people who were similarly searching for supportive care. It took us to Melba and Ehsan at the university to get some research started, because we wanted to know if supportive care was available. So just briefly, before we move on to the next slide, what is cancer supportive care? And briefly, it just means any care that wraps around the official treatment and drug regimens that people are participating in. So it's anything from emotional care, physical care, support financially and legally, palliative care. So supportive care in Kamloops was a bit of an enigma. I was looking for it and couldn't find it myself. So we started the Cancer Supportive Care Society in order to do some research around that. So Melba and Ehsan were doing the official academic research, and you'll hear more about that later. What my group did was engage in a variety of community dialogues with patients and caregivers and allied health professionals. So quickly, we reached out to as many people as we knew who were cancer patients and their caregivers and got their feedback. You'll see some of it here on the screen. What I do want to point out is that, like most of the people that I'm working with right now, is that we are mostly white, mostly Northern European heritage, and that we had the most difficult time trying to find people who were immigrants, or we had several Indigenous patients and caregivers working with us, and some LGBTQ participants. But for the most part, the feedback comes from white, North European heritage participants. What we found out was that cancer supportive care is mostly non-existent in Kamloops. There is some supportive care available through the larger cancer centres in Kelowna, Vancouver and Victoria, but BC stands alone as the only province in Canada that doesn't have a formal supportive care framework through BC Cancer Agency. We're the only province that doesn't automatically provide supportive care. So what is supportive care in detail? Well, this screen is very, very detailed. And I won't go through it because it's hard to read. You'll get it in your conference package as that's distributed after the conference. But we identified 8 domains of supportive care. The medical treatment domain, of course, emotional, financial, physical, caregiver support, which is the most non-existent of non-existent supports, legal, workplace support, and of course the care support that includes things like home care, community, palliative and hospice care, some of which are provided through Interior Health, of course. But the connection to these services from BC Cancer seems to be a bit tenuous, to say the least. So who are we and what are we doing? We are a grassroots group who is now a formal non-profit society. we're working to fill the gaps in cancer supportive care. We want to increase the potency of current medical treatment. Our job is not to denigrate what's being offered through BC Cancer in any way. I'm testament to their care. I'm still here after several years of metastatic disease. They do an excellent job, but their job does not at this moment include supportive care. So the gaps that we're seeing are all of those pieces in all of the different domains, but also the pieces around care for immigrants, care for Indigenous people, care for people who don't fit into the boxes that medical care sometimes comes in. So I like to use this quote from Dr. Doris Howell, who works at the Princess Margaret Centre in Toronto, about cancer and what is supportive care really. She says the life-altering nature of cancer takes place outside clinics. We all spend hours in clinics, in medical offices, but it's our lives that change with cancer. So that life-altering stuff, that's where supportive care comes in. And that's where I think Melba's research is going to be really important. Thank you.
Grace?
This one's me, just had to unmute. I wanted to just define peer support a little bit because there's a mistaken belief out there that we offer counseling. We don't. I have a definition from Mead in 2001. Peer support is the system of giving and receiving help founded on key principles of respect, ability, and mutual agreement of what is helpful. Peer support is not based on psychiatric models and diagnostic criteria. Since as you can see from our slide, we've done everything we can to get out there. Our biggest problem, which I'll touch on later, is that we cannot reach people from outlying and rural areas, which is what this conference is all about, because we are Kamloops based. And we encourage all the women that are coming to ours. It's very private, very, we do not share information, and we do not share medical information such as doctors' names, anything that would relate to personal, we share personal experiences, but not medical information because we're not medical professionals. You can move to the next slide, which is Biruta.
Thank you. Throughout our breast cancer diagnosis, Grace and I discovered that there was absolutely no help. We were never referred to the Canadian or the cancer clinic here in Kamloops. So we didn't even know there was any support. Both of us vowed that we would make that would be a change. So in 2016, the Canadian Breast Cancer Foundation offered a training course in Vancouver, and Grace and I participated. And then we started our own support group in May of 2017. However, we were on our own. There was no financial support. The communities, the Spirit Warriors jumped in, gave us a hand. And we also have been fortunate to have our meetings in a facility where they've given us a reduced rent rate. Cheryl Dedels took the training in 2019 and joined us as a facilitator in 2020. Unfortunately, due to the pandemic, we had to change, or we couldn't meet in person. So the group that we'd already solidified in our meetings insisted that we continue our meetings. It was very important to them to meet every Monday, third Monday of the month. So we went on to Zoom, and it's been quite successful. However, everybody is quite anxious to get back in person. There's nothing like helping somebody to cry or to just say how it is, what they feel like, and realize that they're not alone. Thank you. Grace?
Okay. My last part is I am so pleased that so many Indigenous, cultural, and ethnic groups are represented at this conference, because that's where we can't reach. We also can't reach rural people. Distance and cultural differences made it very difficult to offer support in a good way. We have spent hours on the phone with women from outlying areas, talking to them because they don't even know where to buy a bra and nobody's there to help them. And these things aren't medical, these things are personal, and we need to be able to reach outlying areas. We need to reach people that are going through cancer and are scared and have no help. So that is my main focus right now. I spent just recently somebody on the phone with a lady from Lillooet who of course can't make our meetings. And we want to help those people too, but we need financial help from either BC Cancer Foundation, Canadian Cancer Society. We need more than training. We need financial help to support meetings and to have training specifically for varying cultures, so that support can always be provided in a good way. Thank you.
Sorry, one more, just to search. I hope, sorry about that. It's my hope that the forums such as this bring persons from all areas and cultures and will lead to the awareness of the need to provide support that suits the need of the individual. No one should face breast cancer alone. Thank you for your time.
Thank you.
Now.
All right, so I joined the Spirit Warriors in 2016. I was still in treatment, and quite honestly, that was the only support in the town that I could find. So just a little bit about dragon boating, and I've got something I prepared here as opposed to just reading the PowerPoint that you can see. So dragon boating for breast cancer survivors has become an international movement. This sport provides physical health and mental well-being for those diagnosed with this life-altering disease, and it really is life-altering. The Spirit Warriors are now entering their 13th season, and over 100 women have gone through and worn our Spirit Warriors jersey. Currently, we have, I believe, 34 members. We haven't been on the water for 2 years, so it's a little harder to tell. But 34 members ranging in age from mid-40s to their mid-70s. As you've heard from Anne, is our founding member. We've got 2 members living with metastatic breast cancer, and we've got members who've gone anywhere from just having a lumpectomy with no treatment to double mastectomies, multiple surgeries, chemo, radiation, and adjunct therapies. Almost all of our team members have experienced major or minor ongoing symptoms after our diagnosis and treatment. These symptoms have required further medical appointments, emergency room visits, additional surgeries, and in some cases, hospitalization. Many team members have expressed anxiety and frustration as they try to navigate their way through the medical system. And this is particularly true post-treatment. When you're actually in active treatment, you've got this team that's taking care of you, and all of a sudden they say you're done. And you're kind of left floating there. And like I say, if I hadn't found the Spirit Warriors, I'm not quite sure what I would have done because the support group hadn't started in Kamloops yet. Spirit Warriors has became a go-to support for our team members and also for their families. We recognize that there was further training needed. So the Spirit Warriors with Biruta and Grace starting it up have supported the breast cancer support group. But even that isn't enough, and we do need more help in our interior communities. So as a team, we'd like to see a seamless one-stop cancer supportive care center that meets both all cancer survivors' needs, both during treatment and beyond treatment. Thank you.
Michelle, your speaker, you need to.
Sorry.
It's okay. It's all good, Michelle. Go ahead.
Working with Melba and her team, and it just speaks near and dear to my heart as well, quality of life for people and people that support them. It's super important. Super great. Yes. Yes, thank you. I got a little there, but what we do with what we look for with the research department to support, we want to collaborate on research and quality, inclusion of the voices of the, and community driven by, you know, long-term care community, whatever, driven by the people. Their voices need to be first and forward. Also, IH is a very large area, and we have many rural areas and remote areas, and it's a priority to deal with that. And that's also how do we bring forward, how do we support, and how do we support into the community. We provide evidence that is in informed development, policy practice. That's one things we can do. We can support resources. How do we support that? Identify what's needed, projects, and inform research support and quality of products and different. So that's the focus of what we try to support. So this project, the research impact potential, so the 2021-24, you can see the list of areas of this that the work with Melba and her team is connected to. There's probably only 3 more. It's they've covered quite a bit of them. And they identify the need and support for quality of life, quality of care, the continuing of care and support outside of treatment. And evidence-based, always how we can move forward. That's collaborative and engaged with the people that provide the lived experience. That's the only way, that's where the information comes from, that to provide the support needed, and looking for barriers, or trying to respond to the barriers and make more things more accessible. Next slide, I'll speed that. Is there no? And then also it overlaps, responds to the research objectives of the Health Research Cluster Fund, which is examining system of stress of women diagnosed and treated for MBC interior region, barriers and experiences, strategies and recommendations for cancer care. It'll be in the slide after. Go on to the next.
Yeah, so all my, the peer advocates and patient voice is very strong in this research. And that is what has driven this research into looking at intersectionality framework and understanding what are the factors like race, class, gender, and how they interact with the experiences of women who have been diagnosed, treated, and surviving with breast cancer, and the complex issues that they face, which each of them, the team member from their support groups, have talked to you about. So the intersectionality looks and recognizes the women as shaped by their different experiences and how these experiences exist and make them more vulnerable in the time of health needs, and especially when it's cancer and they need to take a lot of care after the treatment is over. So this study was in partnership with Academic Institutes, Interior Health BC, we mentioned, a study which was ethics approved, and we have used several measurements like qualitative, quantitative, mixed methods to understand what are the concerns faced in the interior region by women who have had breast cancer. So some of the findings, I'll just speak to some of them, which talk about they had moderate cancer treatment distress, like 35% of them had that. 40% of them mentioned they had major side effects from the breast cancer treatment, and they had distress from that for which they have accessed emergency services. And 45% of them said that they were satisfied with the healthcare services that they have received. Some of the other findings talk about they had difficulties to adapt to work after the cancer treatment. Some of them, 45%, said that they had financial difficulty during the breast cancer treatment phase, where they had to travel and take other services other than the treatment that they were receiving from their healthcare providers and from the healthcare system. Some of the other findings talk about them, if they would have had a support person or a caregiver or mentor, then it would have helped them during their diagnosis. 18% have said that, and 44% said that they had to incur their expenses in the travel, and 72% were charged more than $200 for treatment costs, which were not covered by the MSP plan. So some of all these findings come from different groups of women, and based on the team's work and based on the research that we have done, some of the suggestions that have come up is to look at cultural and ethnic specific aspects and take this into account when providing care services or after the cancer treatment, and reflections into what are the support services in cancer navigation and peer support training activities that could be helped and supported in the community to have cancer supportive care, and also looking at professional practices as who are the women from cultural ethnic dimensions, what are concerns they have, and to self-realize that as we go through this journey in our profession, we do have people who come from different walks of life to our healthcare centers, and health policies to look at culturally appropriate interventions, especially linguistic appropriate interventions that are focused on migrants and ethnic groups who receive care. So this is a very brief presentation on the work that we have done. Thank you for your time. So we open this for the audience for any questions. Just stop sharing here. Thank you.
Thank you. We'll just give a couple of minutes if anybody has any questions. I didn't see anything in the chat. Thank you very much, Melba, and Grace, Cheryl, Biruta. Thank you and Michelle, thank you very much for your presentation. I'm also a community member of Kamloops, and so share some of these thoughts and understand some of these experiences to some degree, of course, but really feel like this is very important work. I'll open it again. Are there questions for the team?
You can probably always email Melba later too. Maybe just they have Melba's contact if there's more time to respond.
Sure. And the slides will be available afterwards. Okay. Thank you very much. Fantastic presentation. Yes, Holly, I echo that. And Melba's contact information is in the chat. So thank you.
Thank you very much.
Thank you for letting us
you.
present.
Thank you, everyone.
Thank you.
I hope the dragon boat ladies get back on the